Hello guys, this video will be around the non-clinical questions for the Band 5 static MSK and also maybe like the Band 6. We agreed that the interview can be like non-clinical questions and also clinical questions. So in today's video, we will talk about the non-clinical questions. So the first question is, tell me what do you know about the NHS values? You should know the six NHS values, you should mention them, you should define them, and also try to mention examples from your experience about them. So, the NHS values, the first one is respect and dignity, commitment to quality of care, compassion, improving lives, and working together for patients and everyone counts. Respect and dignity, you should focus on respecting opinions and inclusion. For example, you are treating all your patients regardless their color, regardless their religions, regardless their sexual orientation. Commitment to quality of care. This is our purpose to deliver a quality care to our patients by doing project improvements, audits, or evidence-based or adapting the evidence-based practice. Being compassionate by showing empathy and support for our patients, and also improving lives by adapting the biopsychosocial model with dealing and managing the MSK conditions, working together for patients by example like by working in multidisciplinary teamwork. Everyone counts. It's equality and dignity, and you can also mention some examples about.
A second question. Tell me about your strength points and why you are the right person for this job. So first of all, you have to familiarize yourself with the essential and the desirable criteria for the job that you are interviewing for. You can mention I am a competent physiotherapist with whatever years you have. I have bachelor's degrees. I have postgraduate like master's or master modules. You can mention I'm good at teamwork and the time management. Try to mention things from the essential criteria. Throughout my experience, I gained considerable experience with different clinical cases, and I have the awareness to detect any red flags and to escalate immediately based on the trust pathway and guidelines.
And you can also add, I can see I will be suitable for the job as my qualifications and skills match the essential criteria for the job, and also with your trust values, which are, and you try to mention them. You have to review all their trust values to deliver to them a message that you really care, you really want the job, you really studied hard for this interview. Okay, so they will appreciate this a lot. Another question, how can you deal with an cooperative patient? You can start your answer by saying that my treatment and goals should always be patient-centered. I will try to engage him or her in a shared decision-making approach. For example, like if a patient has a knee osteoarthritis, we have different options. We can do nothing. We can engage you in some exercise or some exercise classes. We can offer steroid injection, but you have to understand the pros and cons of those injections, or we can refer you to orthopedic or a specialist who can uh, review your case, and it might be an option for a total knee replacement. Yeah, and for the patient to decide what is his ideas, concerns, and expectations. Example, if we knew that the patient has a specific expectation, so we have to work towards them and make sure that we and the patients are in the same direction and the same way to meet the patient satisfaction. My goals should be smart, specific, measurable, achievable, reliable, and timed. It should be short and long, and also we should use outcome measures to tell the patient and to deliver this message to the patient that he really improves. Like for example, we should use those outcome measure, for example, a patient with low back pain, so we can use outcome like patient-specific function scale. We can use the star back questionnaire. All of those outcome measure, we can do them before the treatment, before the management, and after the management to tell the patient that he really improving. I should know the cause of this uncooperation. Like if the patient, I should ask the patient, approaches the patient, I ask them why you are uncooperative. It might be like from bad experience, it can be from unrealistic expectations or pain and stress. And the most important thing is to make sure that I document every single thing in my assessment and in my should document everything. I should approach the patient and show empathy and support. Try to have a respectful conversation with him, to ask him about the reason of his attitude and to tell him the benefits of his treatment. If I found the patient is absolutely uncooperative, I may compromise and find a suitable treatment, liaise with other healthcare providers to help in providing alternative treatment. Another question, tell me about the multidisciplinary teamwork and how you are applying it in your practice. You should mention the advantage of multidisciplinary teamwork. The advantages are numerous. I can mention they can give the patient access to entire team of expertise, improve service coordination, expedite the referral process, which can reduce the time to refer a patient, create a new avenue for service implementation. What is impossible in with one healthcare can be possible with another. Like we mentioned before, the patient is with you and you did your subjective assessment and you gave him like your management for 2 or 3 consecutive times. The patient is not improving, so you should liaise and work within multidisciplinary teamwork to refer the patient to another clinician. He might benefit from the input of the occupational therapist or from the ortho specialist. He can offer like alternative management to him, which can benefit your patient. Another thing to have a constant new goals for the patient. And it's mentioned here, for example, liaison with orthotics for a proper shoe wear, liaison with the GP for any concerns or changes in medication, liaison with OT for home assessment, installing tools to help in the environment of the home. Another question, what do you understand about the protection and use of patient information? Use and the transfer of information only takes place if absolutely necessary and if justified where possible. And also, all data should be anonymized. Importance of consent, and we should follow the policy and procedures and trust guidelines. And if something happen, we should fill incident report forms, usual risk assessment, and we have the risk assessment code. So code you can search about it and know about it more. What measures would you take to ensure patient information is kept confidential? Data security, keeping the patient information confidential are very important. For example, you are typing the patient's note. So on your PC, so you should log off the PC if you are if you are coming out of the room. Put all patient identifiable data away and not left unattended. Confidential paperwork, secure emails, and limit sharing of information. And you can also read through the rest. Another question, which can be quite tricky, but it can be quite tricky for a band 5, but most of the time, if you are in a band 6 interview, 100% you'll find this question in the interview. How would you deal with underperforming staff? You as a band 5, you are not responsible for any stocks, but if you are asking this question, so they are most of the time it might be like a developmental band 5 to a band 6, or it is like a high standard trust. How would you deal with underperforming staff? Start your answer by saying that my major concern is the patient safety, colleagues, health, and trust reputation. First of all, I should identify the issue, and this can be from a variety of routes like annual appraisals, error or mistakes, staff member reviewing patient notes, and you find there is a mistake or something happened. If the trust is doing like a clinical audits and they found like most of the clinicians or the clinician are not following the standards, or it was simply like a complaint from the patient. So you should identify whether what happened is affecting the patient's safety or not, compromising the patient's safety or not. If the patient's safety is compromised, I will discuss and escalate the case with my manager. And I'm aware that the senior manager, with the advice of the HR, is the person who determines whether what happens requires suspension from the practice and clinical duties or not. So if the patient safety is not compromised, I will make informal discussion escalate only if fails. I will make informal discussion escalate only if fails. If this is not working, I will make informal feedback or a feedback in a protective supervision slot. I will set formal goals and objectives to address the issue with appropriate review dates. And if all this fails, I will escalate to the head of the department. It's important to identify whether the member of the staff has awareness of what happened, what is the issue, or if there's like a training or a supervision needed or not. We should identify the cause of the underperformance, physically or mentally unwell. It might be like he has a major life event or a change in his job role, a lack of supervision, staff team issues, and diversity problems. He might like alcoholic and taking substance. If the individual is not achieving the standards because of a condition recognized under the Disability and Discrimination Act, then all reasonable adjustments should be provided, and the Occupational Health Department should intervene and can help with this process and provide adjustments. For example, a colleague with physical and mental health, he is underperforming, he is doing mistakes. So you should make sure to liaise with the occupational health to implement adjustment for this colleague to make things easier for him. And the final question in this video, what is the important three questions in your subjective assessment? The eyes indicates to ideas, concerns, and expectations. In your subjective assessment, you should ask the patient, what's your idea about what's going on? The patient concern, if he is like has any concerns or anything in regards to his symptoms, and what's your expectation, just to save time. Because if the patient doesn't want to involve in the physiotherapy and want, for example, a surgery or want a referral to any specialist, or for example, he wants an injection, so you should address and know the patient expectation from the beginning and try to set points to work towards them. Okay, so these are the non-clinical questions for the Band 5 MSK.